The richest data, the industry trends, the primary knowledge. By supplying your organization's information every year, you are contributing vital data to the largest, most robust health IT planning resource available in the country. Participation in the annual study gives you access to information on more than 5,300 healthcare providers across the nation. But that's not all. You also get access to market intelligence reports, your ARA scorecard, and complimentary benchmarking that can help in your health IT planning. And you'll get your MRAM score, your special ranking you can use to track your progress toward a paperless healthcare environment. It's never been more important to streamline your efforts toward achieving meaningful use. When you participate in the annual study, you get access to critical information that you can use to advance your organization. Remember, the more you put in, the more you get out. Health IT facilitates every part of today's patient experience, from admission to discharge. The annual study collects data from your organization in 4 key areas: hardware support, clinical software implementations, cost statistics, and full-time equivalents. Your input from these 4 areas allows you to benchmark your organization's operations, expenses, and employees against 10 peer hospitals based on your chosen criteria. The annual study asks for in-depth information, but you don't have to gather it alone. Our process makes it easy to delegate sections to departments across your organization. And to help expedite the process, we offer 4 convenient ways to submit your data. Reporting your hardware installations allows you to benchmark your IS department operations against similar organizations. Our benchmarking reports help you manage your hardware portfolio as well as your costs, and measure your efficiency to determine what infrastructure you need to support a hospital of your size. Reporting on clinical software implementations is the backbone of your organization's MRAM score. It identifies how equipped you are to capture and utilize clinical data and how you compare to your peers. Our reports can help you understand how effective your operational expenses and FTE resources are when it comes to managing your systems. Reporting your cost statistics helps you see your IS department operating expenses in relation to your hospital's total operating expenses. You can compare this ratio with 10 peer providers. These reports are powerful tools for analyzing your budget and identifying areas where you can be more efficient with dollars or getting the support you need to ask for more. Selecting the MRAM score parameter adds even more dimension to the data, so you can see how department expenses directly correlate to reaching the next stage. This can help you be more effective in forecasting and justifying your budget. Reporting your FTEs is the best way to gauge if you have the right amount of human resources to deliver optimal support across your organization. You can pull reports by equipment, for example, servers or workstations. Or you can analyze by user groups, such as full-time RNs. This allows you to see how you compare to similar hospitals, helping you to determine if you should be operating with more staff or less to best support the equipment and people in your organization. Meaningful use requirements have made your MRAM score more important than ever, and clinical software implementation is just the beginning. Knowing your MRAM score helps you effectively plan and execute EMR strategies and chart a path for achieving meaningful use funding. Through your MRAM score, you can view a variety of benchmarking reports. Your score allows you to compare yourself with other hospitals who are at the same stage. You can pull reports to look at hardware, software, cost, and FTEs directly through the lens of your MRAM score. The value of benchmarking reports and other annual study benefits stretch beyond your IT department. They can be utilized across your organization for monitoring and forecasting costs, creating efficiencies, and justifying initiatives. Another plus, filling out the annual study in full this year will make next year's participation even easier. The HIMSS Analytics Annual Study. Contact HIMSS Analytics to participate today and start taking advantage of the largest, most vital health IT planning resource in the country. The more you put in, The more you get out,